Park City Hospital is a critical anchor in our community. We never know when we'll need the hospital services, but knowing that there's a world-class hospital right here in Park City provides our friends and families with a healthcare safety net.
Communities have a lot of key pieces to them. We have houses for people to live. We have places for people to work. We have schools to educate our children. We have places of worship. One of the key pieces of that community infrastructure that was missing for a very long period of time was that community place of healing, that hospital.
I'd been on the committee for a while. The committee was investigating whether there was any interest in a hospital. If they build it, would anybody come? And they just couldn't raise the money for a feasibility study, and I had just come off having chemo. So it wasn't a mammoth amount of money. And I said, I'll do this, and I did, and now we have a hospital.
We did town halls in various communities to determine what people wanted, what their concerns were, and other things so that we could assure the community as well as Intermountain Healthcare that we were truly paying attention to the needs of this community. And so through that process, we came up with somewhat of what you see today. Everything from the aesthetic value of the hospital, which is when someone walks through the front door to give them comfort, but also from a real estate perspective, when people are looking to buy here, then they are comforted that there is a hospital here.
Most people have come to Park City because they have found a spectacular way of life, a beautiful place, fun year-round. The concept of having a hospital here in Park City is absolutely phenomenal. Great relief, especially for people like us. We have 4 children. We're very comfortable now in having other family members come in and stay, older family members, grandparents.
We need places like this that we can come to when we need healing, when we're sick, when we're hurt, when we need counseling. And for the longest period of time, Park City didn't have that.
It was a Tuesday morning. I was getting up, getting ready for school. I had already showered, done my hair, and I was putting on my makeup. And all of a sudden, I would wake up and realize that I'd fallen asleep and be holding my mascara in my hand. And I did this several times. And finally, I called a friend because Dennis was out of town working. And she came to my door and knocked and finally woke me up and drove me to the emergency room. And when we got there, the doctor on call, who I owe my life, my health, my cardiologist is shocked and amazed that with my symptoms, she realized I was having a stroke.
They saved her life. I'm convinced that Virginia is with us today because of the skill and the care that she received at that hospital.
When people come into this hospital, we want them to feel that they are being taken care of, genuinely taken care of. We consistently get letters from people about the experience here, the quality of care, the interaction with people who work here, doctors, support staff, people who work in the cafeteria. They say that they've never seen anything like it. And it's a steady stream. It's not one a year.
We're very lucky living in a resort town near a large city with a huge hospital system. We get excellent medical care, and clearly what the hospital has done has allowed us to get it up here in Park City so that people don't have to travel down to Salt Lake.
Somebody who was born here in Park City back in the old miners' hospital, and there's probably pretty limited healthcare facilities at that time. And I came to this hospital when you had your opening and visited it. And I said, what a step forward. I mean, it is something that the community really needed.
It took a village to make this happen. Not one individual can make things happen. It takes lots of people to make this happen.
Skiing, biking, and other recreational activities, as well as a growing residential population, have driven increased patient volumes to an average of 12,000 patients per year.
I think we always have to keep in mind that this community will always be evolving and always be changing. Who lives here, who comes to visit here, and their needs will evolve. It's the people who come through those doors that need our help, that need our healing. I don't think that part will ever change.
When we look at the hospital, I don't think that there's anybody in town that could imagine not having it here.
It is a hospital that was designed and built for Summit County and surrounding communities. I hear some people talk about it, they refer to it as their hospital. And that to me is a definition of success.
It's about healing people. It's about making a community complete in what we provide. I'm proud to say that we have a pretty spectacular facility that serves those needs now.